awesome episode, we got to give a shout out to our friends and sponsors at Pet Greens.
Yes, this is like our cat's 5-star salad bar.
Right. They nibble on their organic cat grass like it's fancy hors d'oeuvres before every meal.
Yeah, and honestly, it's really an important part of their routine as well. It helps with their digestion, and it even helps with those hair balls.
Yeah, it does. And it's totally organic. No pesticides, herbicides, or any of that junk.
Nope, just super healthy greens that bring the outside in and help our indoor cats thrive inside.
You can find Pet Greens on Amazon, Chewy, Petco, PetSmart, PSP, and for our Canadian listeners at Pet Value too.
Okay, so now let's get to the podcast.
With wine. Always with wine. I'm Jay.
I'm Adrian.
And together we are the
Two
Two Crazy Cat Ladies. I'm going to cut you.
I think I just peed.
Buckle up.
We're back in the closet.
Welcome to another episode of Back in the Closet with the Two Crazy Cat Ladies. We are super excited because back by popular demand, everyone was just absolutely in love with this lady here, Penny Wood, aka Dr. Zoolittle, longevity junkie, longevity zoologist, back this month, February, to discuss dental health in both big and small cats. So our little tiny tigers here. Thank you so much, Penny, for joining us again.
Thank you so much for the welcome. I love to talk about cats, so the fact that you've given me the microphone again is amazing.
You can have the microphone anytime.
I have to say, the very first time that you were on, we had a bit of a technical. We had some technical challenges. We ended up jumping. It was fun. We ended up jumping on a Zoom. So for anyone that jumped on that technical difficulty, could you give a short intro for anyone that doesn't already know you and love you?
Thank you. Okay, sure. So, all right. Oh, short intro. That's the hard bit. So I'm a longevity zoologist, which just means that from a understanding of animals, I'm looking at how can we help them to live longer. And this isn't to hit a benchmark. This is because length of life is a measure of animal welfare. And if you asked me 5 years ago what I was, I'd tell you I'm an animal welfare zoologist because that's always been the guiding thing. But now it's like niching down to help focus on one thing that doesn't get a lot of airplay. And in particularly in the health world, we've seen a massive reduction in long lifespan. So 50 years ago, we were seeing dogs living sort of 18 to 25, depending on breed size, and cats living to their mid-20s and sometimes, and now that's half, right? Yeah. The average age of a dog is 10 and a half years old. And the average age of a cat is 15. We know that the oldest cat got to 38. So 15 and 38 doesn't compute in my head. I'm like, let me bring my cognitive ethology, my behavioral neuroscience, my animal welfare zoology, and everything I've done in functional and regenerative medicine to kind of pack it together and go, how can we get a bit smarter and start copying nature a bit better to give our ones at home that we love and chose and mean everything to us, the full quality of life that they deserve.
Oh, I love that. And I'll just say from the top here that Penny has a course that she offers to educate us in longevity for our kitties.
She has identified 7 pillars.
Yes.
Of longevity.
And she is so generous enough to give away a membership tonight. So for those who are joining us live, all you have to do is comment in the comments, hashtag membership. And at the end of the podcast, we are going to do a drawing and we are going to pick a winner to get a free. I mean, this is awesome.
Penny, can you share a little bit about what this is? Because this is, yes. I mean, I'm sure that teams are in this, but can you share just a little overview of what this is? And because this is something that's super valuable.
Yeah.
So really quickly then, you've just alluded to the course. So the course itself is Animal Anti-Aging, and it's 8 weeks live in the classroom with me. We're through a session at the moment. We're up to week 6. It's amazing. We take one pillar at a time and dive into everything you need to know from a really general knowledge and practical point of view. So it's not a science course, right? And so that's taking you through how to build a longevity lifestyle for your pets. So you can take all the amazing science that's sitting up there in the universe that you don't know how to read or find or can't be bothered looking for. I get it. I do that for you, and then distill it down into hey, just do this and you'll get 3 extra years out of your pet kind of thing. Like that's where we go with that. So then membership is a year-long access to the longevity library. So it's got all the video, not the course videos, that's something separate, but all the videos of trainings and interviews and workshops and masterclasses and stuff that I've taught that refer to these places. Plus the guides are in there to give you the links of what to find and where to find it. Plus there's a whole bunch of stuff that I can't go into now because it will take too long, but it's a year-long membership where you can have on-call access to anything and everything to do with the 7 pillars of animal longevity.
Wow, a
Just
year-long access.
Just
That is,
incredible.
you are just so generous. Thank you.
So it's on the ticker down here. If you guys are interested in this, I know everyone is, just comment #membership.
Yeah, we've already
And at
got
the
some
end,
comments coming in.
we will do the draw ring. as Jay
Yes,
said.
but today is all things teeth because it
Yes.
is National Dental Health Pet
Awareness.
Month. It's a big long word, but it's all about dental health in February. And so we asked Penny to come back and speak with us about dental health. So let's just jump right in with a top question, right? So you work with so many big cats. We see the statistics are right now with our house cats that I think it's 70% of cats by the age of 3 will have some form of dental disease, and 90% of cats by the age of 7 will in fact have dental disease, like bad dental disease. So we want to prevent this, obviously. What do you see in the big cat world?
Yes.
Let me start with your numbers for 1 second, because do you know what's really mad about this, like crazy wild about this, is that not one single animal, cats included, whether they're our ones or the wild ones, has DNA that codes for disease. They don't. DNA doesn't code for disease. DNA codes for health. DNA codes for life, for building an animal's body in the first place, and all the amazing things that need to connect and integrate and build and whatever for that, and then how to maintain that. That's the instruction manual that every living creature has, right? It doesn't code for getting diseases. So when I hear statistics like that, and I know those numbers and I know what they are for cancer and all these other things as well, because it's ridiculous, right? I know that that's not normal. That's not natural. It might be common, right? And it is common, way too common, but it is not normal. It's not natural. It's not how it's supposed to be. So as soon as we know that, the whole world opens up in terms of hope, because you're like, this is a broken system. And unfortunately, usually it's us that are to blame for the brokenness, because we go, oh, I'll just do it this way without bothering to learn really how to do it. So that means you can undo it. You can undo that. And so when I look at, like, I came into the dental space through working alongside vets in the zoo and seeing all these animals come in for their annual, scale and polish and whatever else. And I was looking at all sides, like the most amazing different mouths out there in the animal kingdom. But anyway, and they were like, oh, yeah, we always have to do this. This one's got, and I'm like, but why? The ones that I used to work with when I did field ecology and wildlife work out in the field, like they haven't got wrecked up teeth. Like we'd be catching animals to measure them and see how many there were and put a little tracker on them and stuff like that for conservation. And we always check everything to make sure that they're okay before because if they need vet care, obviously, then we may as well do it while we've got them, kind of thing. But they're pristine. They're lovely. And occasionally you'll see one that's got like a jaggedy tooth and you're like, oh, poor baby, that one's, had a tooth injury, like it broke off on a fight, or he's just really, really old. And so the teeth are starting to get a bit brittle now, something like that. But you don't see plaque and tartar. You don't see abscesses. You don't get that red line on the gums. You don't see wobbly teeth. You don't have ponky breath. None of it. It's not out there. Why? Because they're doing nature's way of looking after health, right? And so you do nature behavior plus proper, like normal, natural animal DNA, cat DNA, put them together, no problem. So it's us. So go ahead.
Yeah, no, I was going to say then what would you say is nature's way? Like what is the main difference between our house cats and their dental health and big cats with these pristine teeth their whole lives?
Right. So when we think about dental health, there's layers to this, right? This is it's a small space, but it's a really complex environment. It is the gateway into the whole body, right? It's the starting point of, you got to think of the body as a donut, right? This is a funny analogy, but you got to think about bodies as donuts, right? So you've got the inside of the donut, which is actually a hole. Like if I mouth like that and you put a piece of string all the way through me, it's a hole. It's not actually in my body. right? It's inside, but it's not me. The dough part of the donut is where the flesh, blood, and bones are. This is just a great big long hole, right? So you've got to think about it in that sense, that what you're putting into here is staying sort of semi-protected from the rest of the thing. But anyway, what you put in here does then influence what goes into health, right? So anyway, the gateway, so it's layered, it's complicated. It's not complicated, it's layered, it's complex. So anyway, you got teeth, you got gums, you got all the microbiome in here, you've got the saliva and the pH. So we want to address each one of those four main components when we're thinking about what is it that the animals are doing. So the wild animals, to finally answer your question, they are using something in nature to scrub their teeth, something in nature to keep the microbiome in good balance, diversified, protected. They're using something to maintain pH in the healthy range so it's not going too acidic, and they're doing things that protect their gums. So what are the things that they're doing? They're eating carcasses. Like, who knew that it was that simple? Every time they punch their teeth, right? And I'm using the canine teeth as the illustration because those are the punching teeth. These ones, nothing, good for nothing. These ones are a pair of scissors, okay? So they're punching through skin. Well, anytime you punch through skin, you're scrubbing all of the plaque off the tooth. It's like a little rubbery toothbrush. And then you're crunching down on those bones, and those bones are going behind the teeth, around the teeth, the back of the teeth, the front of the teeth, in between the teeth. Right? You're crunching that down, and all the ligaments and tendons that hold the bones together so that the animal, that used to be alive could do its life, right? All of that, that's like floss. Get in between those teeth. So that's rubbery and soft. The bones are hard. We're scrunching off all the stuff that's on the teeth that shouldn't be there. So now they've toothbrushed, they've got clean teeth, and then they go along and they go and eat the intestines of the animal, right? So that animal, let's say, in the case of the big cats, it's usually quite a wildebeesty type of impala, something eating grass and leaves. And for our kitty cats, it's often rabbits or mice or things, and they're eating seeds and grass and things. So that goes into the digestive tract, that ferments, that's green tripe. When they eat the animal, they eat that too. That's their microbiome inoculation. Poof, all of a sudden you've got reseeded the microbiome in the gut because it's going there, but this is still a tube, right? They migrate, right? This is also one of the most innovated in terms of nerves going into it and rich blood supplied place of the body. So what's in the mouth here goes everywhere else in the body. It's not just what you swallow, right? So that whatever's in the mouth is now going into, and this is why it's such a disease-oriented problem. So a dental health issue is a whole body issue. And that's why it's so dangerous, because it's not like, oh, well, we'll just take your tooth out. It has to be clean here to be clean here. So eating carcasses, in fact, cats, because of the nature of the way they kill, dogs are actually a bit mean when they kill because they go after the legs and they typically hamstring the animal, or they pull the belly open while the other animal's still running. It's pretty brutal stuff when you go and look at hunting technique. Cats have laser precision. They're like the sniper, one shot and they're done. So they come out of nowhere, whoosh, ambush thing. They crack the back of the neck. They go for that, and they instantly slide their teeth between the vertebrae all connected like this in the neck. They slide their teeth between the vertebrae. There's a little gap. Cats' canine teeth are actually a little bit flattened. They're not round like a dog's one. They're flattened so they can slide in perfectly between those vertebrae, cut that cord so the animal doesn't feel any pain. And in the process of doing that, they've just cleaned their teeth again because it's a perfect lock and key fit to go in there, clean the teeth, and it means that it's humane for the animal, but it also cleans the cat's teeth. So nature works cooperatively together, even when there's a winner and a loser. So you often get winner-winner situations. This is a winner-loser one, but it still blesses, in a way, the prey because now they're paralyzed, they're not feeling anything, and death is pretty much instantaneous. So it's these kinds of adaptations, which are a bit brutal to talk about, I know, but just like forget the actual mental images. But this is how their teeth stay clean, and then they're going to have to open that up and they eat all those things and it cleans their mouth.
Wow.
Okay, so let's just jump into the fact that this little love loaf on my lap is not going to be doing the and right? Like how do we kind of translate nature into a domesticated
into our homes
situation?
Well, you can. So if anyone's own kitty is a natural hunter, then they are going to be doing that. They just are. That's how they do it. If they're not a natural hunter, if they're not allowed outside, not a problem. All we do is go and buy them prey items for their bowl, or we give them things that are requiring them to punch their teeth through. So that can be cloth, right? If you do it with if you've got a cotton toy, and this is why it's so important for cats to have natural fiber toys, because they're going to do a lot of stuff in their mouth with that. We don't want plastic and polyester and ganky stuff like that. We want to have rope and sisal and wool, and right. But biting into soft woolen toys, it's going to do the same thing.
Wow.
And you can buy them skin. You can buy them dried bits of skin from the pet shop, and then they can punch their teeth. I mean, they've got to chew it somehow, so their teeth are going to work. They don't sit there and just swallow a piece like this whole. So give them something that's bigger than what they can swallow whole. They're going to have to work at it. And in so doing, they are brushing their teeth.
Wow, that's awesome.
We have like Zorro that he's our little stapler. Every time there's a box that comes in, he's got to
there you go. Well, he's doing that too. But here's the thing: when you eat the bones, you then get the minerals, because you've got to keep remineralizing teeth, because they can get into an acidic environment. Meat is acidic. So this is an acidic environment. The microbiome wants to go back to, the pH wants to go back to something around about 8.6, right? Which is actually a little bit more. So 7 is neutral. So we want to push them into the alkaline. 8.6 is healthy pH saliva. So we can do that with things like chlorella and the green algae and all sorts of other supplements and things that we can add into their food to help maintain that. So we're going to support them to do it. Their body wants to do it anyway. But if we don't help with that, because they can't just roam off to a pond and go and eat some algae, right? So we have to provide that for them, and then we're resetting that pH for them. But and ask me questions, otherwise I'll talk too much.
Well, are you familiar with the product Teeth for Life?
Right. It's amazing.
Right, like that same concept of helping to,
and it has the algae in it.
The algae.
I know, we say algae.
I like algae.
I like algae. I'm going with algae. Yeah. We also have downstairs. So there are things that you can get for your cats that are the same thing that you're talking about, right? So we have like a rabbit leg, or the piece of a rabbit. I don't even know what part of the body it is, but a piece of a rabbit that's just been like freeze dried, still has the fur and stuff on it, but it's been like freeze dried downstairs. Our cats love to play with it. They love to chew on it. They love to bite it. Like, these are things. Silver vine sticks. I know a lot of people talk about silver vine sticks as, it has like the silver vine and the sisal, or in the sisal.
Yeah.
On the stick itself, and a lot of cats will take that and chew on that, and that all of this you're saying is like, these are things that we can do in our home so that we don't have to let our cats outside to go hunt necessarily if it's not safe for them.
Correct.
Then okay.
So question: how have you seen in your experience? I like that there's people are starting to identify the difference between health span and lifespan. Right. And you did such a great job on that first interview with you, talking about how we want to, not have this very long, dragged out decline, degeneration, where your quality of life, peaks very early. And then it's just all, how have you seen how dental health impacts health span? Right. It's instead of it just being, it's cosmetic, or it's, my cat has bad breath. How do you see how it impacts overall health span?
Yeah, great question. For many of the 7 pillars that I talk about, there's research that attaches to that particular thing and says, so for example, in the nutrition space, if we're feeding a species appropriate diet as opposed to a highly processed artificial diet, then you're looking on average of about 3 years additional health span in the animal. And if you drop their calorific intake by around about 15%, not every day, but over time, if you can keep them just under what's required, you're actually looking at adding another sort of 2 years lifespan as well. So these these things start to accumulate, you can't necessarily glue them together and go, well, you're definitely now going to get 5 years, because they're a little bit more integrated than that. But there's oftentimes a measurable difference that you can look at. Same with hormones. Hormones, if you can keep their hormones in harmony together, you've got a huge amount of time on the table. With cats, it's up to 10 years more from balancing their hormones correctly, getting that working properly and taking away the threats that they face. But when it comes to dental, I haven't seen a direct number. I haven't seen research that does that. But what I can tell you is the number of diseases that are brought on by poor oral health and hygiene would then be prevented, right? Because if you're not getting the gateway drug, if you like, to those diseases, because you're stopping it at the very beginning, then all of those threats to health, welfare, happiness, freedom, and lifespan are going to be eliminated, or largely eliminated, which means that you are the cat is going to be much less likely to, what's the word I'm looking for? Their mortality risk, that's the word. Their mortality risk is going to diminish significantly than if they have a dirty mouth, imbalanced microbiome. Like, cardiologists in humans do necropsies on patients after they've died, and they were astonished to find that the bacteria infections that these patients had in their hearts, which was ultimately a big part of the cause of why that patient died. It wasn't to do with the blood flowing; it was the infection in the tissues. It's a dead match for for periodontal plaques and things, right? Why? Because blood's coming up from the heart that's been oxygenated by going through the system here and getting pumped around. It comes up here, does a whole lot of stuff in the mouth. You know that you can put something under your tongue and it's in your bloodstream within a couple of seconds and around your entire body in less than 10, right? It's so quick. So all of the imbalance in the mouth is going into the blood, and the blood is taking it straight back to the heart and to other places in the body. So of course these things accumulate. So when we get this right, I don't know how much time we gain, but I know for sure that we push off most of those diseases.
Yeah, I mean, and you think about the statistics when it comes to our cats, right? And the rising epidemics that we're having, and then you look at these statistics when it comes to dental disease in cats, and if you can correlate them, like if we can actually put it in our heads and say, okay, I actually need to do something about their dental health, because that's the problem. We might learn it. We're like, oh, that's really important. Oh, is there something I can put in their water? Cool. But as far as like taking that actual step to correcting this, we'll think about it. We'll end up thinking about it again. This is just for everyone, right? We'll end up thinking about it again later on when they're diagnosed with kidney disease and be like, oh, right. Is there a correlation when they have heart disease? Oh, I did hear that there was a correlation, a direct correlation. We interviewed Dr. Emily Stein, the maker of Teeth, this month as well, and she said that she said the same thing, that the dental health is directly correlated to the heart and to the brain, and of course goes throughout the entire body. But they can see immediate changes in humans. Like her grandmother, the reason she started the product was because her grandmother had to have some dental work done and ended up with a stroke within like a week or something, right? And it was correlated directly to that dental disease that she was dealing with. Dr. Randy, we had on last week, and he said that the same thing, that he tested bacteria in the mouth and of cats, and bacteria in the poop of cats.
No, the urinalysis.
Oh, it was in the urine. Yes, in the urinalysis, he found that bacteria in the urine, and tested the mouth, and it was the exact same bacteria in the urine than it was in the mouth. For a urinary tract infection, and the same thing was in the mouth. So there's enough evidence here to realize that everything that you're saying is true. What is going on in the mouth is going on in the entire body. So it's really important as the gateway to health, as it really is. What do we say? They always say health begins in the gut, right? Mm-hmm. You always hear that health begins in the gut, which is true, but it actually begins in the mouth, because it doesn't get to the gut without going through the mouth. So So this is fascinating and wonderful information.
Talk to us a little bit about your mindset when it comes to preventative care versus reactive care.
I'm so wedded to protection. It's unreal, right? As you know, as a welfare scientist, the main objective is to prevent animal suffering. Like that's why you do animal welfare. You're stopping, whether you're doing it through legislation or through whatever it is, but you're stopping animal suffering. So if we can prevent these diseases, and we absolutely can, because I said a minute ago, DNA doesn't code. Like occasionally you get a faulty gene that will give a predisposition to a disease, or if you're unlucky, you get two alleles that match and they're a weakness and you'll get a recessive disorder, right? But that's the exception to the norm. The standard way that we and our pets and specifically our cats, because they're more sensitive than other animals, will acquire those diseases is through accumulated lifestyle choices. It is through behavioral options that we've just invariably selected for them. So I've forgotten your question already because I get carried away. Remind me.
Yeah, just your more insight into your preventative mindset
versus reactive.
Yeah, so 100% about the prevention. And you can. There are foundations to health that when you set those in place, you equip the body with what it needs to remain here. So I often talk about this thing like homeostasis is balance, right? It's biological balance, and that's where health exists. You can go in two directions outside of homeostasis. Okay, you can go into excess, you can go into deficiency. And you go through grades. So you sort of get small signs and symptoms. That's your warning light to say, hey, take action right now. This is not just it happened for no reason. Nothing happens for no reason, right? So signs and symptoms here, and then we start to progress and we get a cluster of those. And traditional medicine likes to call a cluster of symptoms a disease. And now we've got a label for it. And it's like, this is what this looks like. And then what happens is you don't address that. Well, everything's connected, right? As we just talked about. So that then feeds into another disease. And you'll see people go, oh my gosh, I've got like 7 different medications because I've got all these diagnoses and all these disease, right? Now they've got what's called comorbidities, right? And what happens when comorbidities, right? Then you've got death. So there's a progression in both ways. We don't want any of that. We want to stay here in a homeostasis. The body wants to stay here. The mind, the will, and the emotions of the pet wants to stay here. It's our job as their pet parent to just furnish them with the materials and resources that they need to stay there. And in this particular case with cat dental, right, it's about giving them some carcass feeding abilities, to give them some pieces of rabbit or skin and the more fur, the better, because now they're getting the fiber, the prebiotics that the body requires. If you give them bones, now they're going to get the minerals that they require to rebuild the teeth. The collagen, cats need to have about 30% of their bowl as collagen tissue. So they're eating the connective tissues, and the skin itself is collagen, so is fascia, so is cartilage, right? All of that they're going to get from that is going to be nourishing their body, as well as you always get a win-win when you do it nature's way. You get leverage. You get a multiplication effect of good health across the body when you copy nature. So I don't believe that any cat deserves or should or need to get a disease. Like, they don't deserve it. They don't need to get it. If you're super unlucky and you have that combination of genetics and epigenetics that then flicks on that switch, okay, that was unfortunate, but there's still things you can do there. But for the vast majority of these things, it's in our hands. We hold 90% of control over their health destiny. We talked about that last time. So it's just a case of getting empowered, getting smart, knowing a couple of things like, oh my gosh, let's bring in some carcass feeding. Like, it's not hard. You don't have to do something awkward and uncomfortable if you don't want to. There are all kinds of cleaner, sanitized, less confronting ways of doing it. But let's be real. If you're going to have a cat, please acknowledge that you have a cat. Right? You don't have one that eats biscuit, toast, right? If you want an animal that eats toast, go get a different pet, right? Like, so be realistic. You can't expect them to change however long of years of evolutionary biology just because you're squeamish about a thing. So let's get a little bit more honorable to our cats and say, this is what you need. This is who you are. This is your biology. This is your natural behavior. I love you, and I'm going to provide that for you. And now you get to have all the benefits of being super healthy. And let's be real as well. When they're healthier, it's much healthier on our pocket. So if you don't do it for their sake, and you're a little bit more selfishly inclined, well, you're going to save a lot of money, because they're not needing the interventions, the medicines, the therapies, the car rides, right? So
Right.
Right.
And one of the things I remember thinking about that, I wish someone would have told me, oh, your cats are obligate carnivores. Like, I didn't even know what that was until many, many years after my first cat. And when we were going through that transition of getting our cats on a healthier diet, it's like, wow, feeding them a raw, balanced diet is a little more expensive than a bag of Meow Mix. And kind of that mentality, because Jay was all in, she was like, we're going to pay for it now or we're going to pay for it later. And paying for it now is so much bigger than you think about the suffering that we will hopefully be avoiding, that whole thing. And dental disease is one of those things that it is such a silent thing. Our cats are so stoic. It's so hard for us to know. It's like, are they turning their head a little bit when they're eating? Do they pop their mouth? Are they eating as much as normal? It's like we don't necessarily know that there are dental issues going on. Do you have some telltale signs, things that we should be looking for?
Yeah, sure. So anything that is preferential in the mouth. So if we're chewing on one side, I know I say chewing, but like using one side and not the other side. If there is drooling, if there is bad breath, is there pouring at the mouth? Have you got your cats on, have you trained them with the ability for you to open up their mouth or ask them to open their mouth? I was literally talking today about how we train the animals in the zoo to respond to this cue here, which means open your mouth. And now I can put my hands inside a sea lion's mouth, inside a snow leopard's mouth, and I can have a feel and make sure that it's all good in there because they're voluntarily holding their mouth open, right? So, it's great if we can have some kind of trust-based relationship where we can make these requests and do cooperative care with them, right? This is the training that we do in zoos, cooperative care for animal health and welfare, so that they can participate in a way that gives them a reward, a treat, as something pleasant that they want at the end of doing the thing, but I can do a check on them and make sure they're okay. So if you can look and see, is there a red line on the gums? Is the gum tissue soft? Is the gum tissue like the pink that it wants to be, or is it red, inflamed and horrible looking? So visually looking is a big deal. And you should be doing that fairly regularly, but also they're going to yawn. So just have a good old, look when they're yawning, film them when they're yawning, and then watch it back on slow motion. Things like that. It's so simple, but they will hide. It's a great point that you raised. They will hide their pain. And they will take on a lot of pain, and it really hurts. I don't know if anyone's ever had their own teeth hurt for whatever reason. Like, oh my gosh, you just can't get to the dentist fast enough. So really, this is such an important issue from the suffering side, aside from where else it can go with other diseases and other bits, right? But from a suffering point of view, and that's always the worst part of any kind of disease or whatever, is how much of an emotional burden of they're going through, which breaks then the trust they have in you, because they're like, I'm trying to tell you, look, I'm touching my mouth because if I was out in the wild, I'd go fix it myself. I'd go and eat something to clean it, or I would whatever, but they're not getting it in a sterile home environment. So again, it's our responsibility to be a little bit smart and say, let me care. Let me put on the calendar. Every 3 months, I'm going to open up and have a look inside your mouth. Every 6 months, we're going to go for a checkup or whatever. It's like you work out your own schedule, but like it has to be part of, like, you feed them every day. You've got to also think on that mindset. You've got to look after dental health on a regular system.
Yeah. I love that. I know we're running out of time here.
We have a question from YouTube though. I love this question. Can we give them, for example, raw chicken wings? What say you?
Yes. Chicken wings are actually fantastic for cats because so when you're a bird, you've got to have what's called a hollow matrix bone. So the bone is not a solid, dense piece of like concrete, the way like a cow leg bone has got to take an enormous amount of load-bearing weight to hold up that big-bodied cow, right? It's a solid, hard bone. Cats aren't going to do anything with that, right? But a bird has got to have hollow matrix, a really light bone, so they can fly and get off the ground, right? Those are too heavy to fly. So they've got hollow matrix bone, and then things like wingtips and necks, right? They're the kind of the softer and bendier of the bones. Lots of collagen around those. Perfect way to do the intro to bones if your cats have never done that before. And there's lots of gnarly bits inside. There's lots of like corners and tricky bits, right? So the more complex the bone is, like if you have a rib bone, it's just like, well, it's just, it's super smooth. But if you have one of these kinds, then it's going to be doing more cleaning work in the mouth.
Yeah. Yes. Let's clarify that it always needs to be raw, Never.
Please, yes,
Yeah.
always,
Yeah.
always raw.
Never cooked.
They're very brittle and they'll break off and they'll do terrible things.
They can do damage when cooked. So if you're eating chicken
stomach
wings
acid,
because it's a football game, don't share that with your cat.
When you cook a bone is protein. When proteins are heated, they denature, and we see that a steak goes from pink to brown, an egg goes from clear to white, right? When you cook a bone, it denatures the bone protein, and what used to be able to be broken down to some kind of rubbery mush by the stomach acid of the cat is now in such a matrix and format that it can't be. So it stays a rigid, solid piece of bone. So a cooked bone will always be solid, rigid, and then impossible to get safely through the digestive corners. A raw bone will go into the acid, be demineralized and turned into like a wet noodle and be able to go anywhere through the digestive system, plus give all the benefits of that additional mineral complex that can then be fed to the rest of the body. So it has to be a raw bone, because as soon as you cook it, you've just ruined the whole thing.
Yeah. Wow. You are so well spoken. I freaking love your donut explanation. Like everything is just like you always know how to bring it real, so we all can understand what the bigger perspective here. Okay. So I one more question that
and then we're going to do the giveaway, and you have a free gift for everybody. So don't go anywhere, guys.
So everybody gets a free gift. If one person gets a giveaway to a year-long membership, which is absolutely amazing. Learn how to keep your cat living forever. Love it. We still hear to this day. And I know for you and I and Adrian, this is all like old news and kind of funny, and it's been debunked for a long time, but literally even veterinarians are still telling our cat community that Kibble cleans the teeth. Can you give us
what would your response be?
Why do they think that? And why is it not true?
Can you imagine that I'm your dentist? Yeah, just for 1 second, I'm going to be your dentist. And you come in and you're like, oh my gosh, I've got all this bad stuff here and this one really hurts. And I say, hey, don't worry. I've got a massive bag of toffees here. Just go and chew on those toffees. Get those in your mouth. Chomp on them. It'll be great. And you'll be like, did you really go to dental school? Right? At what point ever is sticky sugar the thing that you want to cover a tooth with?
Right.
I mean, where did logic go in that equation? So the reason they say that is because they don't learn nutrition at dental school. They don't learn nutrition at vet school, right? Because medicine, as we kind of know it in the conventional sense, likes to keep compartmentalized, right? So you study dentistry here and as if it's separate from the rest of the body, and you study the heart like it's in another box over here, right? It doesn't work like that. So if you're a kibble, by definition, for it to become a kibble, needs to be approximately 50% carbohydrate and sometimes as high as 65%, right? So it's jammed full of sugar. That's what carbs are. They get broken down in the system as sugar, but they're sticky molecules that hold onto your teeth, just like toffee does. So if you're going to cover your teeth with that, you're going to expect the plaque's going to have an absolute field day with that. It's like Christmas on drugs. And so they're in there multiplying like crazy, right? But what are you using to wash it off? Nothing. So it sits there and it's going to get worse and worse and worse. They say that because the kibble manufacturers and the people who make dental sticks and treats and things, right, are the ones that sponsor vet schools. Right? There's a hand in glove relationship, right? And whenever you have a weird question like, why on earth is that the case? That doesn't make sense. Just follow the money. Just follow the money. You'll find out why it's that way. Now, they probably are not intentionally trying to give you bad advice, but that's the toolkit that they've learned, and that's all they know because they're busy learning that stuff, and they didn't come over here and hang out with me in zoology school and learn what real animals do. So they are limited in their advice. But also, sometimes they get kickbacks from the company if they push particular products. So there's a vested interest as well. So again, follow the money. But use your common sense as a pet parent to say, you can't possibly clean teeth with sticky sugar.
Right. Yeah. I like that. Sticky sugar.
We did have one other question that we asked everybody.
Oh, well, we asked you this, but it was off camera. So we're going to ask you on camera because we have asked everyone this month about tooth resorption. So in our kitties, for whatever reason, they get these resorptive lesions, and there's no science behind it. We have asked veterinarians. We have asked lots of veterinarians.
It's terribly painful. Usually ends in a full mouth extraction.
It's horrible.
Extraction,
horrible.
Right?
Right.
And what do you think? Because we don't, because there is no science, it's fine. But what is your theory as to why our cats are so prone to getting these tooth resorption, TRs, as they call them?
So I have been looking at this more recently. Tooth resorption. So when you have your milk teeth grow, like your baby teeth grow, they need to then kind of dissolve down to use those raw materials to then grow the adult teeth. Right. There's a chemical process that's going on, a signaling thing within the biology that says, hey, you need to start dissolving that tooth down. So this is what happens. So it's completely natural and normal behavior, biology, and the whole thing when they're babies and they're in that development stage of the changing their teeth from deciduous to permanent. What tends to happen is that signaling molecule comes back online, and it's like, oh, well, I'm back. Now I'm just going to dissolve away your grown-up teeth. And that's a disease condition. That's the disaster, the situation. So we need to do some stuff that changes the chemistry of the signaling so that we can block that thing. It's got some, I even wrote it down because I was like, I bet you're going to ask me this question. So I'm so glad that I wrote this down. So where's the word? Okay. Osteoprotogenin. Okay, osteoprotogenin. So this is why I had to write it down. Osteoprotogenin. So it's known as OPG. So this is the thing that has to be changed so there are supplements that you can take. In fact, estrogen, a type of estrogen like HRT kind of thing, will actually help to change that chemistry. Magnesium and vitamin D will also help to do that. And then to repair it, you can bring in stem cell therapy. So inside the baby teeth, inside any tooth, is tooth pulp, and that's really young tissue, rich with stem cells. And you can harvest from baby teeth that have been lost. In humans, you typically don't find baby teeth in cats when they drop them, although I do have one from one of my cats. But you can also get stem cells from other things, or you can use stem cell nutrition, stem cell activation. There's lots of other therapies. You don't have to spend big bucks on this kind of thing. Everyone can do this. And then that will help to regrow the teeth that have been started to be eaten away as if they were a baby tooth that needed to be broken down to grow another one. Thing is, you never grow another one, and you don't get a third one, not like sharks. Like sharks and elephants have this constant conveyor belt of teeth that just keep coming out of their mouth until they don't, and that's why they die, right? They don't die because they're sick and old. They die because they run out of teeth, because they get so many teeth cycles and then they're all over Red Rover. So we're not like that. We have two. Your faces are hilarious. Let's do another. We talk about
they get old, they die because they run out of teeth.
What? Yeah.
Oh, that's
There's a rescue elephant called Anne. She lives in one of the zoos in the UK. She's the oldest elephant we know about in captivity. She used to be a circus elephant. She was rescued. We've got a documented birth date. We know how old she is. She's ancient. This elephant has one tooth left, and we're trying to really help preserve her tooth using things like pulse electromagnetic field therapy and other work, because we know that when the tooth goes, it's right, but she's had so much love and care, even though she had a rough start in life with some things, right, that she's running out of teeth.
Wow.
So
I'm coming back for the elephant episode.
But with our cats, they're not supposed to have a third wave of teeth. Right. So we don't want the grown-up tooth to get dissolved down, and it also dissolves bone. This stuff goes to town in ways that we don't want to. It was great when they were little and we needed that to happen. Somehow or other that switch got turned back on and it's doing it again. So we need to stop that chemistry signature with some of those therapies I talked about, and then we need to rebuild the matrix of the bone, the tissue, the gum tissue, the gingiva, and the tooth itself, including the enamel, and all of it can be regrown with stem cell therapy.
Wow, that is so phenomenal. That is so much this is great. This is fantastic. Do you think that possibly the reason that we're seeing so many of these could have anything to do with the spay and neuters that we do early on then?
I'm still digging into it. I don't want to be too premature on these things.
Okay.
However, the list of things that happens when we do an early, and I stress early, right? Spay and neuter in and of itself isn't necessarily a bad thing. It might not be the right choice. It might be the right choice, but an early one is categorically the wrong choice, right? 6 weeks of age, right? And then you tell their biology through a fairly invasive operation, which is never pleasant for anybody, that they're now effectively 60 years old.
Yeah.
You change their biology so that they are decades in their own time scale, not our decades. They are decades in their own time scale older 5 minutes after they, well, an hour after they, right? So this is horrific on the body. It accelerates the aging process. It opens the door to countless different disease conditions in the body. So why would it not also be on this? It's mucking up all kinds of chemistry. I did this whole discussion about how the hormones in the body are like a symphony orchestra. You have a conductor who's coordinating everything to work in harmony. And you have this section and this section and this section and this section, all the instruments playing their part. Each individual hormone is playing its part. If one of them gets taken off stage, we've taken the ovaries out, we no longer don't have a gland that is pushing out progesterone and estrogen. That's gone. That symphony orchestra doesn't have that component anymore. So what happens? Luteinizing hormone comes in and goes, I'm going to play bigger and louder to make up for the fact that you don't have estrogen and progesterone anymore. And so luteinizing hormone is now 30% bigger and more intense, which then mucks up all the other ones. Right. So you now don't have a symphony orchestra. You have a cacophony where one's trying to fill the gap of another one and it doesn't work properly. So you can imagine how many downstream issues there are when this starts to muck up. And if you've got a cat who happens to also be overweight and has diabetes problems with insulin and glucagon, or you have some other issue with the thyroid, whatever. Now, I mean, these are all endocrine disorders. So now you've got all kinds of ridiculous, crazy stuff happening on the chemical side of the body, which every cell in the body has hormone receptors to receive that and then activate and do stuff accordingly. Like, it's phenomenally complex, but it's really elegant in what it does. But if you mess it around because you took some living tissue out of a cat that was functioning just fine before they had a chance to put to use what it's supposed to do, which is to grow their body correctly, grow their bones correctly, grow their brain correctly, give them a sense of confidence in who they are as a cat when they're, I mean, who knows when they are when they're 6 weeks old? They don't know anything yet. They've just opened their eyes and started, walking around. And all of a sudden you now made them be a 60-year-old with not a clue on how to be a cat, and their bones are all going to go like this now. Of course, it's probably going to have some kind of effect here. Can I draw a direct correlation? Not yet, but I'm looking at it.
Oh my God, Penny, we love you. Dr. Zoolittle, you are the best.
Just incredible.
Absolutely the best. Thank you so much we've got to, I feel like we should have you back every month, and we should just, because everyone loves you.
Just
Thank you.
Yeah.
In a better time zone, so you don't have to stay up till 2:00 in the morning.
Right.
Okay. Can you give everyone, while we're pulling up the giveaway tool right now, can you tell everyone that's just jumping on a little bit too? This is a year-long membership. Take it away.
This is a year-long membership. This is the Forever Club, right? Forever Young is the name of the membership, right? This gives you access to the longevity library that I've curated and created over sort of 5 years of masterclasses, training sessions, workshops, interviews, training class, like all sorts of things. And then in addition to that, there's additional resources for where to find certain products, the recommended list that I have, introductory guides to stuff, the feline dental guide that is available for everybody that talks about some of these things I'm talking about today, is inside the membership. So the membership person is going to have that. The rest of you can also have that, but inside membership are all the other ones as well. So there's an omega-3 one, there's a detox one, there's nutrition stuff, there's all of each of these 7 pillars of animal longevity. So those are the 7 aspects of their lifestyle that you can have considerable control over to transform their health span and therefore how long they live.
And therefore their lifespan.
I
love it.
You just hinted at the free gift that everyone's going to get. We're going to drop it in the description.
Yep.
When we're done here, that's the free feline dental health guide.
Yes. All right. So now let's go ahead and do the giveaway. So we're going to do a draw ring. Everyone who is entered.
Only 9 entries.
Only 9 entries. Go ahead and drop it. You got about 1.5 seconds before I push this button. And we are going to draw to see who gets the year-long membership. And let's go.
so excited.
And the winner is Carol 6453 from YouTube. Carol, congratulations. Just shoot us an email at info@twocrazycatladies.com. That's TWO crazycatladies.com, Carol, and we will send you the link to the membership.
Oh,
and,
you lucky girl.
Yes.
That's
Lucky.
so
Congratulations.
All right, we're wrapping up. What's one thing that you hope every cat parent understands about dental health from tonight? Or in general?
Buy your cat raw bones. Buy your cat raw meaty bones. They will get about 57 benefits from this. It costs about 10 cents to get a hold of these things, and it will save you thousands in dental work and care and problems down the line, and be a joy for your pets to be able to do what is nature intended. Like it's so easy. You can buy a tray of wingtips. You could go to the chicken necks are my favorite thing because of that thing I was talking about, the shape of the tooth and all the extra collagen and stuff that's in there as well. So, and they're 10 cents at my butcher's. So
yeah, super
incredible.
cheap. Great.
All right, where do people find you and follow you and be as obsessed with you as we are?
You can just go onto Instagram at Dr. Zoolittle, and you'll find that you can DM me there. You can find stuff there, and that'll have in the link in bio bit, it'll take you through to websites and offers and free gifts and stuff that I've got. So that's usually the best landing. I mean, there's a website too, drzoolittle.co. That will tell you a little bit more about maybe the science and other things. But if you are looking for goodies, then go across to Instagram.
You're the best.
Penny,
thank you.
Thank you so much.
Thank you so much. And thank you all for joining us tonight. And we will see you guys back next week for our podcast talking about dental health and herbs with none other than the Rita Hogan.
Oh my gosh.
All right. Exciting. So we love you guys, and we will see you all very soon.
Thank you, Penny. Good night, everybody.